What is tuberculosis or TB? Tuberculosis or TB is an infectious disease caused by the bacteria Mycobacterium tuberculosis, which primarily affects the lungs but can also spread to other parts of the body, such as the bones, kidneys, and brain. It is transmitted through the air with a person with active TB of the lungs, cough, sneeze, talks, or speech, releasing tiny droplets that others can inhale. Not everyone who is infected becomes sick. Some develop latent TB, where the bacteria remain inactive in the body, while others develop active TB, which causes symptoms like a persistent cough, chest pain, fever, night sweats, and weight loss. TB is curable and preventable with proper medication, early screening, and consistent treatment, making it important for communities to be aware of its signs and follow medical guidance to stop its spread. Why does a person get tuberculosis or TB? Person develop TB when they inhale droplets containing the Mycobacterium tuberculosis, bacteria from someone who has active TB in the lungs. These tiny germs are released into the air when an affected person coughs, sneezes, talks, or even laughs. However, not everyone who breathes in the bacteria becomes sick. People are more likely to develop TB if their immune system is weak due to stress, poor nutrition, smoking, other illnesses, or lack of proper tests. Living or working in crowded places with poor ventilation also increase the chance of infection because the bacteria can stay in the air longer. In short, TB occurs when the bacteria enter the body and the immune system is unable to fight them effectively. How to avoid tuberculosis or TB? TB can be prevented by following the proper steps to protect yourself and the people around you. A clean and well-ventilated environment is important because TB spreads more easily in crowded and poorly ventilated places. It is also necessary to cover your mouth when coughing or sneezing and use a hard kerchief or mask to keep the germs from spreading. For children, the BCG vaccine provides strong protection against severe form of TB. If someone experiences a persistent cough, they should immediately get checked and follow the correct treatment to avoid affecting others. Eating healthy food, getting enough sleep, and avoiding smoking also helps strengthen the immune system, allowing the body to fight off infections. How to cure the tuberculosis or TB? Tuberculosis or TB can be cured through proper and complete medication prescribed by a healthcare professional. The treatment usually involves taking a combination of antibiotics every day for 6 months or more depending on the severity of the illness. It is very important for the patient to follow the full treatment plan if even they start feeling better, because stopping early can cause the bacteria to become stronger and harder to treat. Patients are often guided through the DOTS program, directly observed treatment short course when health workers help ensure that medicine are taken correctly. Along with the medication, patients should get enough rest, eat nutritious food, and avoid smoking or drinking alcohol to help the body recover faster. With early diagnosis and consistent treatment, TB is completely curable.